Innovation goes to dentist. Anyone can guess what was the innovation? जिसका पूरा क्रेडिट डेंटिस्ट पे आता है. This was one of the most important innovation in ophthalmology. And this innovation is the sutureless cataract surgery, what is known as phacoemulsification. And every year more than 1 crore 10 million cataract surgery are performed worldwide, and 90% cases are done by a technique known as phacoemulsification. और जो phacoemulsification का जो आविष्कार हुआ था अल्ट्रासोनिक, the credit goes to dentist. So this is the reason why I came here to interact with you today. So if we start about the history, if we talk about the history, the Sushruta, and there are a lot of surgery was described as Sushruta, and you can see this is the cataract surgery being done that time by the method couching, and this is one of the old photograph where the teeth extraction is being done, and still today you can see witness this kind of street side ophthalmology. And yes. So this is he's trying to check the number of the glasses, and most of the villagers, they are getting the presbyopia correction by this person who is working on the street. And this is the straight side dentistry. And there are no rules and regulation on these people. They don't need any license, and there are no medical litigation against these cases. So if you talk about brief history of ophthalmology like dentistry has undergone tremendous evolution, and the most significant evolution in ophthalmology which changed the practice of ophthalmology is invention of an intraocular lens. And this is very fascinating history, very exciting history. The intraocular lens invention was done by Sir Nicholas Harold Ridley, and this discovery is post World War II. I had opportunity to work with Dr. Ridley when I was working in the US, and I wrote his tribute also. This is the tribute which was published in one of the. And on 15th August 1940, there was a pilot who forgot his safety goggles while flying the Hawker Hurricane 2. So Hawker Hurricane was the best fighter plane of Royal Air Force, and this plane was similar to what we have in Rafale right now. So this was very powerful, very latest that time, 1940. So he forgot. Ridley, 10 years back, some medical student came to Ridley's OT, operating theatre, and he told Ridley that it's pity if you cannot replace the lens with an artificial lens. So Ridley got the idea. The medical student instilled the idea in the Ridley's brain. And when Ridley treated this wounded pilot, his name was Gordon Mouse Clever. So when he treated this pilot, he saw that the glass particles were inert. So he got the idea to manufacture the lens, and he manufactured lens in top secrecy and implanted on 8 February 1950. This is the historical clip. This implantation was done at St. Thomas's Hospital in London, and that time the surgery was done using large incision. You can see the very large incision with Von Graff's knife, and this is 12 millimeter incision. The lens was removed in toto. You can see the lens is being in toto, and this was extracapsular cataract surgery. And then this is the intraocular lens which Ridley is implanting, and this lens was manufactured by the Retina company. And after Ridley's work of lens implantation,
This was one of the most most important breakthrough in the history of ophthalmology. Now, the second breakthrough came when Charles David Kellman, the father of phacoemulsification, invented phacoemulsification. So Charles David Kellman he was a doctor, but he had tremendous love for music. So in the night time, he used to attend the various programs and used to play saxophone and other sing some song. And he became doctor. And during that time, when he was working as an ophthalmologist at New York Eye and Ear Infirmary, that time most of the patients they used to admitted in the hospital for 2 weeks because of the large incision, and at that time the suturing was not done. So the patient need to stay stay like this, sleep like this with the 2 sandbags on the side. They cannot move their head also, because if you move your head, there is a big incision with a Von Griffith knife, as you have seen in the video. The vitreous will come out, and there will be poor healing. So the patient would be admitted in the hospital for 2 weeks. So Charles Kellman wanted to shorten this time. So he wanted to invent some technique which can facilitate the catheter surgery to 3 mm incision. So he worked very hard and he applied for the grant. So he got the grant from the Hartford Foundation. The grant amount was $250,000 US. He worked very hard for 3 years, and when 3 months was left, only 3 months were left, he was unable to find out the solution. And this is the phaco machine handpiece. So he was unable to find out the solution, and this video shows his story. This is the documentary Through My Eyes, and this is the Charles Kellman during his young age, and you can see he has he's very fond of music, and he's playing saxophone, and Charles Kellman was very much passionate about the research, and he wanted to devise a method to remove the catheter through a small incision. And he worked very hard, but he tried everything. He tried to use the drill machine inside the eye to cut the cataract. He tried everything, but he was tired, and he eventually wanted to give up. So and this is his name, Kerry Adams. He used this name while singing. So before giving up, he decided to to clean his teeth, and you see this is the large incision for removal of the cataract, 12 mm incision, and this is the cryo extraction of the cataract. He invented the cryo cadet, and with the freezing technique he removed the cataract in toto. So this is the cryo technique, and this is freezing of the lens, the ice scalpel. So Charles Kellman was very much motivated, and he was unable to find any way. So during that time he visited a dentist, and the name of, you can see this is the patch they are putting in the eye, and this is aphakic glasses. These are the aphakic glasses, very thick glasses when the lens was not invented. And so Charles Kellman visited a dentist, and the name of the dentist was Dr. Larry Cohen. So he visited Dr. Larry Cohen, and Dr. Larry Cohen was very much interested for new technology. So he recently purchased an ultrasonic scaler. So when he used scaler to clean the teeth of Dr. Charles Kellman, he told, stop. And this is Dr. Larry Cohen cleaning the teeth of Dr. Charles Kellman.
Like this, that had various tips. He saw the way it vibrated at thousands of times per second, and saw the stream of water cool off the end of the tip.
Onto the cataract without it jumping away.
So this is dental burr, and this is high speed cutting needle. So this is how he got the idea of removal of the cataract. So Dr. Charles Kelman, he hugged Dr. Larry Cohen, he hugged his assistant also, and he just rushed to his laboratory, and he got so many nucleus. जो मोतियाबिंद थे वो लेके आए, and then he tried to use his burr to cut the cataract, and this burr he was able to successfully cut the cataract. So he modified this dental burr and invented phacoemulsification through with the help of Cavitron company.
Then knock 'em dead. If you're really as good as you think you are, all the confidence is in your head. It's a world of illusion. It's a Hollywood masquerade. No one will know how scared you are. Put on a big charade.
So this is Charles Kelman singing during a program, and this is how he worked. He revised this dental burr, and with so many modifications, finally he was able to invent a technique which changed the future of ophthalmology. And this is the phacoemulsification remains one of the biggest invention in the history of ophthalmology and biggest invention of the
This is, of course, the standard operation with the 180-degree incision and the sutures necessary to close that incision. This is the incision for this new operation, phacoemulsification.
My business is, my business is, no business like show business, and that's why I'm here. You, and you, and you.
So this is the story of Charles Kelman, the father of phacoemulsification, and he got the idea from a dentist on the dental chair. So we remain really grateful to all of you and to entire dental fraternity for this innovation. Thank you, Dr. Larry Cohen, who was renowned dentist of that era. And another innovation I want to talk about, the osteo-odontokeratoprosthesis procedure known as OOKP. And this procedure, this is the brief video. And this procedure, you use a tooth to prepare the keratoprosthesis. And this is how this tooth is implanted on the cornea, and this is a special device, and this keratoprosthesis is very helpful to see the patients who are blind because of the corneal disorders. This is known as OOKP, or a tooth for an eye. And we are living in an era of social media, and there are so many tattoo trends, and it looks like something people are getting, the imprint in their tooth, whatever they like. And similarly, we also have tattooing in the eye, and this is some of the photographs eyeball tattoo. And some people, they don't like the white eye, so they really got their eyes looks like very, like a ghost. So this is the injection of the dye for eye tattooing. So this is not common in India, and I think, but in European and American countries, this is not uncommon. So there are so many myths also about the dental treatment. Sometimes patient comes कि दांत निकलवाया था, आँख की रोशनी खराब हो गई. This is a myth, very common myth, and I think most of the surgeons, most of the patients, they have this myth, which is so much fixed.
और this myth is very common कि दांत निकलवाने गए थे, आँख की रोशनी कम होगी. The reason for this myth is that कि times patients visit doctor, dentist, and they visit the surgeons like ophthalmologist also same time. And because of cataract, their vision is decreasing and they leave it to dental treatment. So there are few complications are reported. For example, endogenous endophthalmitis or central branch retinal vein occlusion or transient diplopia, etc., transient loss of vision, etc., during the dental treatment or after while undergoing dental procedure. But these are very self-limiting, transient, most of the anesthetic-related complications few hours. And some of the rarest complications, for example, the endogenous endophthalmitis or the branch retinal vein occlusion is also very uncommon. So it's very uncommon, and if this happens, always the patient can get the expert opinion from ophthalmologist, and it's very important responsibility for us to educate the patient so that we can speak about the dental and teeth facts. Is it true? What hand you write will typically determine what side you chew your food on. So these are some of the interesting things which I
Extremely important, and no one is strong enough to bear the pain either. To end this talk with a very clear message: smile till you have teeth, read till you have eyes, and work till you have hands, and travel till you have legs. And I want to thank you for your attention. And dentistry and ophthalmology are similar because you are putting a smile on the face of every patient every day. And ophthalmologists, we are doing smile to remove the glasses. There is a technique known as smile to remove the glasses. So thank you so much once again, all the office bearers and respected members of IDA Kota branch, to give me the opportunity to share the very important history and to share the role of dentistry to make ophthalmology one.